When talking about the word doctor, we could include any provider that you use for all your child's care, such as a pediatrician or any others who are providing care, such as well-child visits. You know, when you go in and they tell you what percentile your child's height, weight, and other things, and you smile and shake your head and think, so should my child be at the 50th percentile or the 100th? I've always been told 110% is best. And what does it even mean? You're also there for sick visits such as colds, flus, ear infections, or stitches that you would think we should be immune to, since we already have our plates full with other medical jargon. Well, I'm here to tell you that your doctor and the staff not only could, but should be doing so much more. What I'm talking about is providing a medical home. What that means is an attitude or a belief that care is provided. It's not a place like a house with that oxygen sticker on it. As I talk about this kind of care, remember, there are no bad doctors. Really, no bad doctors. Just maybe not the right one for you and your child. This means that if you want care that looks like what we are talking about, it is okay to ask your current provider about this or look at another practice that has medical home philosophy. A medical home should not be only a source of medical care and medication management, but rather a place that helps families coordinate all the care, including non-medical needs, such as financial, respite, family-to-family networking, just to name a few. You will have so many different providers come and go through your child's childhood and teen years, but a primary care doctor can be one of those consistent places that you can go. It should also feel like it is a comfortable environment, like home, where you can go that everyone knows your child and your family name, and you are not explaining everything over and over and over again. With that said, a true medical home team recognizes that the family is the constant in the child's life and has valuable experience about the child that is extremely valuable in the child's overall health and development. We all know that our children's health and well-being, as well as our own, is much better if we're treated in the context of our whole selves, which includes our family, community, school, as well as our social, recreational, and spiritual, as well as our emotional needs. Here are just a few helpful hints that will help you build your medical home partnership with your healthcare professionals. Ask for an office visit that will work best for your child. If you know that you will need more than the allotted 12.5 minutes, okay, that 12.5 minutes that are usually given, ask for the latest appointment before lunch or the last appointment of the day. Or if you know when your child will do the best, ask for that time and explain why. Ask the office to assign a care coordinator to your family that can help with all the questions that you may have, especially when the doctor's not immediately available. If it would help, ask for the same nurse or room when feasible to help your child. Also, ask to meet the office staff that will be working with you and your child, such as the nurses or the referral coordinator, even the billing person. It is so much easier to build a relationship with a person that you can meet in person. Ask if they have a registry of children with autism and other special needs, so that when you call to make an appointment or need a return call back, the staff at the office knows your situation. Ask about how to get the care after hours if needed, again with someone that not only they trust, but you will trust as well. Ask the medical home for a plan of care or medical summary that you can take with you to the other gazillion of doctors, specialists, agencies, or educational professionals, so that you don't have to repeat some of the same information for maybe this time the billionth or the gazillionth time. Provide a sheet that has helpful hints such as the About Me form. Always keep a notebook about issues and concerns that you have and bring it with you to each and every appointment. Share information about how your child is changing, whether it's progressing or regressing, not only from your perspective, but others in your child's life, such as the child care provider or teacher, to help make the best possible plan of care for your child and family. Ask about the resources that may help your child and family, and just as important, share those resources that you've used. The family's collective knowledge, all of our knowledge, is what will help not only the professionals, but more importantly, other families of children with autism and special needs in that practice. The medical home can be an important part of your circle of support. Remember, communicate, communicate, communicate. The more effectively that you can talk about what the needs of your family are, the better others will understand and help. Though your family does have special needs and circumstances, others do as well, even those who are working there. Remember, everyone has a story and we are all in this together. All families should expect this as the type of care that they not only need, but they deserve. It takes a little work to start, but it will make your life a little easier along the way, and who doesn't want something that is a little easier or maybe even a lot easier? Let your healthcare providers be a part of your journey. The right team approach and the right care can only help you and your family reach your child's maximum potential. There are so many things that we cannot control in our lives, but keeping our children healthy and protecting their well-being as much as possible with a healthcare team that we trust and we know truly cares is something that we can be in control of. Having some sense of control really helps build our sanity as parents, and believe me, we need all the sanity we can get. All of the information and tips that were just mentioned would work with any provider, including dental providers. A quote that I like, because we spend so much time angry and there are so many things that are not in our control, is every 60 seconds you spend angry, upset, or mad is a full minute of happiness you'll never get back.